Good evening, everyone. Wynn Brown here with the COVID-19 update for Heywood Healthcare for Wednesday, the 20th of January. I hope you all had a good day. Very busy at Heywood Healthcare today. But at first, I thought I'd start out with some nice comments from the community. There are a lot of them here in this, embedded with this video, in the email that you can read, but a shout out to our staff who are working incredibly hard right now. Just a few of the comments. I've had wonderful care at this hospital. My experience with Dr. Ryan, Dr. Krasowski, and Dr. Zoni have been wonderful. Radiology, major surgery, with inpatient care, surgical daycare, and ER have all been top-notch. Great doctors and nurses. Excellent hospital. Thank you for helping me. I've always been treated very well, and Dr. Toman was wonderful. Absolutely. Patients come far and wide to seek our expertise. He and his care team, this is Dr. Zazzoni and Toman, I'm assuming, did my husband's knees and rotator cuff. We love him. Always treated well at the hospital. So thank you. There's a lot more in here for you to read, but I just thought I'd give you a taste of it, and I know it bolsters up everybody on the care team and throughout the health system, knowing that the community is supporting what they're doing. I also had the opportunity to round at Heywood today, primarily in Watkins 1 and the ICU. Got a chance to talk to some of the staff and witness the hard work that they're doing, and I appreciate what they're doing. I also rounded in the lab today on the Heywood campus. Got a chance to chat with some of the staff, and obviously, you know, our testing is really through the roof, especially with our outpatient COVID work that we are doing. So shout out to those staff as well. And again, a shout out to everyone, and I will continue to give shout outs to different departments along the way, and hopefully we'll get everybody covered. Looking at testing in our region, our overall rate throughout the pandemic still sits at 4.2%, above the state at 3.65%. And our 7-day positive rate is 7.71, so down a little tiny bit, but still well above the state at 5.94. And then I also have the statewide data there for you to take a look at. Just to let you know how busy we are at 30 inpatients in the health system right now, five of whom are in our ICU. So very busy, incredible pressure on our staff to provide excellent care, and I appreciate what they're doing, and I know that the community appreciates it as well. Under infection prevention, Joan Doyle, who is our director of infection prevention, met today with the Athol staff, and also we videoed that to talk to them about the vaccine and infection prevention. And so we've also included a vaccine education video from Johns Hopkins here for you to take a look at, which I think will be helpful and informative. We've also been talking with the local boards of health in our region about, as well as the Massachusetts Public Health Network, about vaccinations in our region once we hit phase 2. And so we're working collaboratively with them to plan a variety of public flu clinics. And currently the focus is on right now on home healthcare workers, group homes, and congregate housing, but then we will be moving into the community phase as well, and we're going to work collaboratively with them to support each community and play a role wherever we are needed. Just to note, if you are in phase 1 and you are a clinician and have not yet gotten the vaccine, Cornerstone Family Medicine has a number of vaccines that they can give a week for who meet phase 1 requirements. There is a waiting list right now, but if you'd like to get on their waiting list, it's 978-669-0199. Speaking of vaccine clinics, we have another vaccine clinic coming up. We have a shipment of Moderna for our staff in the health system. And the dates for the Athol Hospital Clinic and the Heywood Hospital Clinic are in here. Just a note to staff, when you go in and you sign up for that, make sure that you scroll down after you select the time for your first dose to go down and click this for your second dose as well. So you have to sign up for 2 different times when you use that if you are a staff person within the health system signing up for that. So that's where I think where we are right now for today. Again, very busy. Please do everything you can outside of the hospital walls to keep safe. Have your best practices. Wear your mask. Wash your hands a lot. And please socially distance and don't gather in large crowds or large groups so that we can continue our journey to be one of the best community-owned health systems in America. Have a great evening, everyone.